Assalamualaikum, my name is Nur Hafizah Muhammad Rosdi 139180. I will talk about treatment method used for fish lice infection in fish farm. Fish lice, Argolus species, family Argolidae, are branchial crustaceans that parasitize both marine and freshwater fishes. Argolus species can be a major threat to fish health because heavy infestation can cause a significant morbidity and mortality. In addition, fish lice are known to be the vehicle for other fish disease by Steckler and Yanong 2012. Argolus has a direct life cycle, meaning it only requires one host, which is the fish, to completely develop from an egg to a mature reproducing adult. Argolus japonicus is native to Asia, where it typically hosts goldfish and common koi carp are also located. In the United States, Argolus japonicus is present in Florida, Georgia, California, Hawaii, Maryland, Washington, and Wisconsin. Gresti et al. 1993 state that Argolus lice can be known to the vehicle for other fish pathogens including Rhabdovirus carpio, which is the larval nematodes, and the fungus Saprolegnia. Because of their size, all the stages of Argolus can be diagnosed with the naked eye. The parasite are visible moving on the host or swimming in the water. The parasite can also be identified on a wet mound of the infected fish. Captured fish should be examined quickly because Argolus may rapidly leave the fish once it is disturbed or removed from the water. Filtering water from the system through a fine mesh may also help capture free-swimming Argolus adult or juvenile. Several medications have historically been used for bath treatment of Argolus, but potential resistance to treatment, current availability, legality of use, especially in food fish species, dosage rates, and associated costs and fish species sensitivity may reduce options. It is best to work with a fish health specialist. Prolonged immersion of an organophosphate pesticide such as trichlorphon, which acts by disrupting the nervous system, has been an effective treatment when dosed at 0.25 to 0.50 mg per liter active ingredient once a week for 4 treatments. Diflubenzuron is another pesticide which acts by interfering with the parasite's molting or shedding of the outer skin exoskeleton during growth and development. Diflubenzuron effectively kills both adult and larval stages, but it is a restricted use pesticide and applicators must follow label instructions. Potassium permanganate 10 mg per liter for 30 minutes or 1.3 mg applied twice over 3 days have been shown to be effective in killing the juvenile and adult stages of freshwater species in several studies. Potassium permanganate is not recommended for use in marine system. Increased salt concentration does not appear to be effective for the control of Argolus in freshwater, nor does formalin. Of all the drugs that I have mentioned before, only potassium permanganate is legal for use in fish intended for human consumption, and its effectiveness may not be ideal. There are currently no approved products for use in food fish species. Consequently, it is critical to know where your fish are coming from and to quarantine new fish before introducing them to your system. Potentially infested fish should not be mixed with clean fish without a proper quarantine. As the conclusion, drug choice and length of treatment for Argolus infection should take into consideration the life cycle of the parasite, which varies from 30 to 60 days depending on temperature and species. Treatment should target all life stages including egg, juvenile, and adult, both on the fish and in the environment. Adult species can be manually removed from the affected fish, but this is impractical in many situations and is an incomplete solution because eggs, unattached juvenile, and adult will still be present in the environment. That's all from me. Thank you.